Hello, my name is Dr. Dallin Robinson. I'm a chiropractic physician in Slidell, Louisiana. I've been a chiropractic physician for over 30 years, treating chronic health problems, severe musculoskeletal problems. What I would like to do tonight is share with you some of the information that I've gleaned over all those years. The goals of this DVD, I want to give a very short version of a great deal of information that we provide in this office, through this office, and on longer videos. I had someone contact me through my office Facebook page. Their question was, what can Robinson Natural Health Solutions do for me? This person has lost over 30 pounds. They have chronic fatigue, multiple food allergies. They're looking for answers, and like you probably, they haven't found them yet. What I want to give is a great deal of information on a variety of subjects like chronic fatigue, fibromyalgia, neuropathy, thyroid symptoms, vertigo, memory, concentration, mood, hormone dysregulation, food sensitivities, blood sugar. This may not include your specific diagnosis, but there are common threads that run through all chronic health conditions. Again, I want to have a maximum positive impact on you and any other chronic condition patient that is looking for answers. I want to eliminate the necessity for you running from doctor to doctor searching for problems. I want to eliminate the necessity for you to sit there and wonder whether some new drug is going to be beneficial or maybe give you side effects that you'll regret. I want to help you turn back the clock and help you reinvent your life. I want to open the door to a normal life, let you know that you can get your life back. I am a member of the neurometabolic supergroup. Dr. Michael L. Johnson, that started that group, wrote the book, What Do You Do When the Medications Don't Work? And a great deal of this information comes straight from the neurometabolic supergroup. We are continuing to learn and add more knowledge all the time. Some of it comes from the book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? You can go to lifechangingcare.com. That's lifechangingcare.com, and see testimonials from people who have been treated by doctors belonging to this neurometabolic supergroup. Many of them probably have the same problems that you have. They certainly have the same common threads. Take a look at that, take a look at their testimonials, and see if you can't recognize someone who is in the same situation, was in the same situation you're in now. You need to have a pen and paper ready, because in this video I'm going to address the major causes of chronic health disorders. The major chronic health disorders: inflammation, toxicity, a decreased or altered immune response. Once again, my name is Dr. Dallin Robinson. I'm the owner of Robinson Natural Health Solutions here in Slidell, Louisiana. As a chiropractic physician for over 35 years, I've been helping people with chronic health problems find relief without drugs or surgery. Myself, I have suffered injuries from severe falls to severe car accidents. Many times an accident or stressful situation will trigger what we're going to talk about tonight. I myself suffered from undiagnosed thyroid for many years because the usual lab test did not indicate a problem. So I know what it's like for many of you. So get ready to learn something. We're going to help you get your life back. You may say, who are you, a chiropractor? I thought y'all were just about neck aches and back aches. Well, chiropractic was discovered in 1896 when a man named D.D. Palmer adjusted Harvey Lillard. Harvey Lillard was deaf. By the end of the day, his hearing had returned. Now, D.D. Palmer thought he had discovered the cure for deafness. He didn't cure the deafness in too many more people, but he found all kinds of other problems clearing up. And that was the birth of chiropractic. Chiropractic has always been about helping to restore health without having to use drugs or surgery. And those chronic aches and pains that you tend to think about chiropractic for, the ones that return month after month, year after year, those chronic aches and pains of the spine are often traced back to the problems we're going to talk about on this video. In this office, we use applied kinesiology, functional neurology, spinal decompression, cold laser, nutritional functional medicine, which means we take a look at blood chemistry, take a look at lab work, we take a look at neurology, how well your brain and your nervous system is functioning, correlate all that together to find out what it is that we need to do to help you. First of all, I do not treat a specific diagnosis. I don't have a magic fibromyalgia treatment. I don't have a magic thyroid treatment. I don't have a magic chronic fatigue treatment. We treat the whole body. We're concerned and we treat the whole person. My job is to support the body for overall healing, because this is what it's all about, achieving maximum healing and health. My goal is to find the most effective ways and enhance and balance your immune system, decrease inflammation, and detoxify you so that you have the best possible chance of living a long, normal, healthy life. So what are the chronic illness symptoms that you may have, that you may be struggling with? It could be chronic pain, chronic fatigue, insomnia, sleep disturbance, brain fog, irritable bowel syndrome, migraines, cluster headaches, impaired memory, poor concentration, skin sensitivities or rashes, anxiety, depression, tinnitus, dryness of the eyes or mouth, dizziness or impaired coordination, poor focus, movement disorders, balance, blood vessel stability, mood stability, organization problems. Any or all of those may be what you're dealing with, but once again, the common threads, common causes are inflammation, toxicity, and a decreased or altered immune response. What you have is a chronic illness, which is a whole web of physiological dysfunction. You may have blood sugar imbalances, you may have an adrenal dysfunction, you may have gut dysfunction, you may have thyroid dysfunction, hormone imbalances, liver, immune system imbalance, brain and neurotransmitter dysfunction, cellular dysfunction, mitochondria dysfunction, mind-body issues. You may have problems in any or multiple areas here, and then each one of those have subcategories that we have to look at and solve in order for you to get your life back. Once again, the major causes: inflammation, toxicity, and a decreased immune response. First cause, acidity. Then we look at free radicals and excitotoxins, infections, hypochlorhydria, and there's something called impaired methylation. The first cause, acidity, you need to find out what the pH is of your body. First thing in the morning, before you start taking in fluids or food, you need to check that first morning urine pH. Now, I've had patients come in, they took the saliva pH and the urine pH. They were real happy because their saliva pH was a 7, which is what it should be, but their urine pH was like a 5.5. Urine pH should be 6.4 to 7, and we're concerned about urine pH because that's what has traveled through your body. That is far more important than checking the saliva pH. Your body uses minerals to keep your body at 6.4 to 7, so minerals are very important. You have billions of chemical reactions that occur in your body every second. These reactions rely on proper nutrients and minerals. Minerals like calcium, magnesium, trace minerals, they're very important because these minerals are necessary for many body functions, and they're also important for helping your nerves fire. If your body loses calcium and magnesium, your nerve cells are going to end up firing too frequently. And if those nerve cells are pain fibers, you get chronic pain. Number 2 cause of massive inflammation, toxicity, and a decreased immune response: free radicals and excitotoxins. Free radicals are atoms or groups of atoms that have an electrical charge. That abnormal electrical charge ends up being highly reactive, and they cause damage to our DNA, our mitochondria, cell walls, and the protein that's in our cells. It causes changes. Things don't work right. Cause of free radicals, mainly a poor diet, use of trans fatty acids and hydrogenated oils. They used to tell us that margarine was so much better than regular butter. Well, now we know that those hydrogenated oils are far worse. A diet high in refined sugar, white flour, and white salt can be the cause of free radicals. Food sensitivities like gluten, dairy, and soy can end up causing free radicals. It may come from toxic chemicals, hormones in meat and dairy, pesticides in fruit and vegetables, even chemicals like BPA, which is in plastics. When you heat that plastic in a microwave to warm food, it gets in the food that you eat. You may have a problem with heavy metals, free radicals, due to mercury amalgams, nickel and dental crowns, aluminum and antiperspirants, packaged foods, hair colorings, and dyes. If you have two dissimilar metals like an amalgam and a nickel crown in your mouth, your saliva is a saline solution. You put two dissimilar metals in a saline solution, you basically have a battery. It's kind of like that outboard motor in salt water. Begins to corrode, you get an ion exchange. In your mouth, it can leach the mercury out of those fillings 80 times faster than it normally would. Now, when aluminum binds to excitotoxins like glutamate or aspartate, its entry into your brain is many times faster. Once it's in the brain, the aluminum causes free radical damage. One of the things it's associated with is Alzheimer's disease. Excitotoxins are substances like glutamate and others that damage the nerve cells by excessive stimulation. They basically adhere to the receptor sites on the nerve cells, continue to stimulate that receptor site, and can stimulate that nerve to death. The most noticeable ones, the ones that are the most pervasive, are the glutamate, in other words, monosodium glutamate or MSG, and aspartame, NutraSweet. We're talking about NutraSweet. So you talk about aluminum, MSG, and NutraSweet. Aluminum comes in deodorants, the antiperspirants. Aluminum powder that a lot of people spray under their arms, aluminum powder. Then you breathe it in, it gets in your bloodstream, makes its way up toward the brain. Then you go down to the fast food joint and get some of their food that has MSG in it, because MSG makes it taste good. That's the way they can take that cheap food, make it taste good so that you and your kids want to eat more of it. And then you get a diet drink because you don't want all that sugar. The diet drink has aspartame in it, which is another excitotoxin. Those adhere to the aluminum that you just took in your body, makes its entry into the brain a lot faster. A recipe for disaster. You may be getting xenoestrogens. Xenoestrogens are chemicals that link to the estrogen sites on the cells and stimulate as if they were estrogen. Now, too much or too little estrogen is another cause of inflammation. You may be getting hormones from meat or pesticides in fruits and vegetables, dairy from well water. Many pesticides have xenoestrogens in them. They may be coming on grapes, wine, apples, celery, bell peppers, peaches, strawberries, nectarines, spinach, lettuce, cucumber, blueberries, potatoes, green beans, kale. Any of those substances that have been sprayed, you may be getting xenoestrogens. You may be getting excipients, which are the fillers, glues, and flowing agents, which have non-nutritive properties, but they use in vitamins and nutritional supplements, basically to make it easier to process the pills or the capsules. Typically, they're approved for short-term use, not the long-term use like in a daily vitamin. An example of that is magnesium stearate, which research shows has immune-compromising properties. You may actually be taking in silicon dioxide, which is, they use it as a flowing agent, and it is basically just sand. I want you to know that this is not just Dr. Robinson making a bunch of stuff up. We've got tons of references for everything that we're talking about here. I'm not going to go into it because I'm trying to make a short video here. Number 2 cause of massive inflammation and toxicity, decreased immune response, infections. Big ones are dental infections and root canals. These are like hotels for bacteria that pump out toxins for your body that your body has to deal with. Now, if your body is already under stress and then there's an infection, it can push you over the line, developing these chronic health problems that we're talking about. The dentist that took my amalgams out said he frequently finds infections underneath those amalgam fillings. Some of the doctors on the neurometabolic supergroup tested people, found crowns that were obviously a problem, sent them to their dentist, pulled the crown off, found massive infection underneath. Or people who ended up pulling a root canal, seeing that there was massive infection in that root canal. You may have an amalgam filling which is expanding and contracting at a different rate than the tooth around it, causing minute cracks that get larger and larger over time. Those also create great hotels for the bacteria, which in turn pump out toxins that your body has to deal with. Another problem with amalgam fillings is that those small cracks get larger and larger over time. Then one day you're eating something very, very soft, part of your tooth falls off. These things, once again, this is not just Dr. Robinson making this up. You can go to www.noamalgam.com, the International Academy of Oral Medicine and Toxicology, and read the same things that I just told you right here. Other infections contributing to massive inflammation, toxicity, and decreased immune response. Gut infections or an imbalance in the bacteria that's in your intestines. You're supposed to have good bacteria that produce nutrition for you to absorb and utilize. If you have the wrong bacteria in your gut, and there's a lot of research out there talking about different strands of bacteria being associated with different health problems. Parasites. People don't want to think they have parasites, but if you have traveled to foreign countries, if your friends have traveled to foreign countries, if you have pets, or even if you have traveled to the mountains and drank out of that nice clear stream, you could have parasites. Mycoplasms are bacteria that do not have cell walls. Most antibiotics work by destroying the cell walls of the bacteria. If you have mycoplasm infection, then those antibiotics are not going to work very well. Biofilms are bacteria that get into an area of the body and they create a little film. Your body is not able to fight that off in the situation that it's in, and they continue to pump out toxins once again that your body has to deal with. You may have H. pylori, those bacteria that grow in your stomach. You may have subclinical infection of liver flukes. In the beginning, I did not think that would be a problem, but we're finding out that liver flukes is actually a problem. A number 4 cause of massive inflammation, toxicity, and decreased immune response, autoimmunity. That means that your immune system is attacking your body. Part of the problem is that 80% of your immune system is in your gut. So people with digestion problems, and some people don't realize they have digestion problems. They tell me they can digest anything. Well, I can look at them frequently and tell they have digestion problems. But if you have a digestion problem, typically you're going to have an immune system problem. Causes of massive inflammation, toxicity, and decreased immune response, hypochlorhydria. That means you have a decreased amount of stomach acid. Hydrochloric acid helps to digest the food and allows for better flow in the lymphatic system, and it helps to create something called methyl groups, which are very important. Now, if you have hypochlorhydria and you're having heartburn, that is actually lactic acid. You need the hydrochloric acid to digest the food so that you don't have that lactic acid buildup. Antacid sales in this country are a $40 billion industry, and they are damaging people's health. Hypochlorhydria, number 1, you can look at blood. You can look at the blood test, total protein, serum globulin, blood urine nitrogen, and phosphorus to tell if a person has hypochlorhydria. Or we can do muscle testing, applied kinesiology, to find that out. HCl helps you digest your food. better flow in your lymphatic system, and create methyl groups. Concerning methyl groups, did you ever wonder why you might have had a chronic illness or problem show up? Well, the problem is you may have expressed a bad gene. You may have expressed one like an autoimmune disorder, MS, ALS, Parkinson's, MTHFR, or cancer. Let's take a minute. MTHR, methylene tetrahydrofolate reductase, that is an enzyme. But you have to have a proper gene to create that enzyme. Methyl groups are attached to genes, and when you have depleted methyl groups, that's how you express bad genes. Because good genes, methyl groups help the good genes stay turned on, the bad genes stay turned off. Let's talk a minute about the healing crisis bucket theory. The way your body uses folic acid and methylfolate is, first of all, to the mitochondria. That's what gives your cells energy. If you're chronic fatigued, then there's a good chance that the mitochondria is having a problem. When your body has enough B12 folate, methylfolate for that, then it begins to supply it to the growth factors that your body needs, which is very important when you've been ill or for teenagers during their growing years. If you have enough for that, then it spills over and it's utilized by the immune system. If you have enough for that, then it's utilized for dopamine, serotonin, in other words, helping you feel good. The crisis comes in when you do not have enough and it does not provide enough to go to these next stages of utilization. That's when you end up with a healing crisis. Your body is not able to push forward and heal from that problem, and it becomes chronic. The methylfolate deficiency symptoms are poor natural healing, mitochondrial weakness, poor inflammation control, T-cell immune weakness, poor hormonal function, poor toxin clearance, and down under the limited dopamine, serotonin production, you end up losing focus and concentration, you have poor sleep patterns, you have emotional instability, and poor hormone regulation. With a methylfolate deficiency, when we're talking dopamine production and serotonin, that's what gives you the feeling of feeling good, good times. If you do not have enough of that, then the anxiety neurotransmitters, the fight or flight transmitters become dominant. The ones like epinephrine, norepinephrine, glutamate, and acetylcholine, that gives you a chronic feeling of anxiety. Symptoms of methylfolate deficiency relating to the emotional and the brain, nervous system, memory, concentration, focus, organization, mood stability, sleep patterns, hormonal regulation, pain thresholds being lower than they should be, seizure thresholds lower than they should be, bowel motility is not what it should be, eye movements, focusing, blood vessel stability, immune balance. Take a look at eye movements. When we do a neurological exam on a patient, we're looking at eye movements and the very minor abnormalities in those eye movements. Poor methylation, poor immune balance. If you have less T cells than you're supposed to have, then you're going to have less killer cells. Killer cells are what kills viruses, bacteria, molds, yeast, fungus. Regulatory cells tell the B cells whether to go out to kill, whether to multiply. If you do not have enough regulatory cells, then these are going to be more active or more plentiful. The result will be inflammation and allergic reactions. So what helps you create methyl groups? Well, HCl, hydrochloric acid, the same stuff that helps you digest your food. You need hydrochloric acid and you need a potassium buffer in order to help restore the depleted methyl groups in your body. Methyl groups are also needed for phase 2 liver detoxification, protein methylation, homocysteine metabolism, neurotransmitter synthesis, and nucleic acid synthesis, and to keep your good genes turned on and your bad genes turned off. When you have depleted methyl genes, bad genes like cancer genes are turned on, and good genes that help keep that under control are turned off. Inadequate methylation can lead to birth defects, depression, cognitive decline, fatigue, cancer, and even autism. HCl is required for creating these methyl groups, and it's needed for homocysteine and energy production. Homocysteine is an energy methylation marker, which I prefer to see, but rarely ever see on the blood work that people bring in. Homocysteine is needed for the production of the major antioxidant glutathione. You need it's the mother of antioxidants. Your body produces it, but you need homocysteine in order to produce glutathione. Major causes of chronic illness: inflammation, toxicity and decreased immune function, acidity, free radicals and excitotoxins, infections, autoimmunity, methylation. These are things that we've talked about. We have answers for these problems. We're talking about a chronic illness, a whole web of physiological dysfunction. Once again, it may be thyroid, it may be gut, adrenal, blood sugar, mind-body issues, hormone imbalances, liver dysfunction, immune system imbalance, brain neurotransmitter problems, cellular dysfunction, and all the smaller problems that combine together to create what we term as chronic illness. Once again, the solutions, this book right here, What Do You Do When the Medications Don't Work? Dr. Johnson has written several books that are available on these subjects and others. Chronic fatigue, blood sugar, he's even written a book on cancer. He is the head of the neurometabolic supergroup. You can go online and get more of his information, but a great deal of this is based off of those books. When we take a look at blood test, what we want to do is we want to tighten up the ranges to more reflect a healthy person and shoot for getting into those functional ranges. These are not just ranges that I dreamed up. Functional Medicine University is one of them that have established those ranges. We look at blood work. We may need to look at thyroid, run more thyroid tests. We may need to run some food sensitivity tests to indicate whether your intestinal lining is breaking down, an organic acid test to tell how your body is using, how the Krebs cycle and other cycles in the body are working. Stool bacteria and parasites, we talked about that. An adrenal stress index to tell how your adrenals are working. We may need to run hormone balance, which the adrenal stress index also includes, the one that we run also includes a great deal of hormone balance. We use applied kinesiology. You have sleep points, energy points, thyroid, parathyroid, stomach, adrenal, liver, pancreas. All the organs in the body have acupuncture points and applied kinesiology points that we can test. You may have interference fields, which can be from trauma, it can be from surgery, fractures, tattoos, piercings, blows. Any type of trauma along an acupuncture meridian blocks the energy flow to that internal organ. For instance, thyroid, you can have a blow or an injury to the forehead, nose, chin, neck. That can block the energy flow to the thyroid, creating chronic thyroid trouble that may not show up. The reason may not show up on blood work. You may have a trauma to the forehead, nose, chin, chest, clavicle, even a hysterectomy or an episiotomy that can interfere with the stomach energy field. Emotions, I have recommended a book, Feelings Buried Alive Never Die. It talks about if you have an emotional episode in your life and you do not heal from it, it can show up later in life as an illness, as a chronic illness. In Chinese medicine, we know that emotions, for thousands of years, they've said emotions are related to specific organs and pain syndromes are also related to specific organs. In other words, the liver is associated with anger, resentment, and jealousy. It is also associated with neck and shoulder pain. The kidneys are related to fear and anxiety, and they are also related to low back and leg pain. In this office, we are concerned with structure all the way from the top of the head to the tip of the toes, but we're also concerned about the functional neurology that I was talking about. We're talking about muscle weakness, cramping, tingling, numbness, nerve pain, abnormal movements, balance problems, and like I said earlier, even in a socially inappropriate behavior. Under the metabolic part, we were talking about all those things that we've mentioned earlier, but we may need to especially look at anemia, blood sugar, inflammation markers, autoimmune markers. When we use functional neurology, do the evaluation for that, we're looking at poor eye movements, balance problems, movement problems, memory problems, sleep problems, sensory loss, increased pain, and like I said, socially inappropriate behavior. We're concerned about inflammation. We need to look at the acidity. We need to find out if you need more minerals and vitamins in your body. We may need to give you nutritional supplements that help to balance the immune system. Toxicity issues. We're concerned about free radicals, excitotoxins, mercury, infections, parasites, and biofilms. We're concerned about an altered immune response, autoimmunity. We're concerned about methylation problems, emotions, interference fields. We want to know if you need more hydrochloric acid, if you're getting too much sugar, salt, not enough water. So ask yourself, how's your problem affected your family, friends, finances, relationships, and life? What does it cost you in time, energy, sleep, and happiness? You may say, what is the guarantee if I proceed in this direction? Well, the guarantee is that if you keep doing what you're doing, if your health has been going downhill for years, the guarantee is that if you keep doing what you've been doing, you're going to get the same results. We're here to provide answers for those who have not found the help that they need. So I've given you a substantial information. If you want more information, call my office, go on my website. Share this DVD because there is somebody that you know who needs this information. My website is robinsonnaturalhealthsolutions.com. You can go there and get more information. We're constantly adding more to that site. If you really want help, if you're concerned, call my office to set up a free consultation. Bring whatever blood work that you've had taken. We'll sit down and talk to you and build a roadmap to help you get your life back. That will be the first step. Once again, my name is Dr. Dallin Robinson. I am the owner of Robinson Natural Health Solutions here in Slidell, Louisiana. My phone number is 985-288-5520. I look forward to helping you get your life back.